be with us. Marius-Ionuț Ungureanu is an associate professor and chair of the Department of Public Health, School of Political, Administrative and Communication Sciences at Babeș-Bolyai University. He's a medical doctor with extensive training in healthcare management and policy, and a background in health workforce, health systems, and public health research. He's currently serving as chair of the Department of Public Health and director of the Center for Health Workforce Research and Policy, both within the School of Political, Administrative and Communication Sciences at Babeș-Bolyai University in Cluj. Marius also serves as president of the Health and Care Workforce section within the European Public Health Association. And if I may add to it, also a professor, assistant professor at Johns Hopkins Bloomberg School of Public Health, if I'm correct. Marius, the floor is yours.
Thank you so much, Theo. I believe you can hear me well and see me well. First of all, it's a pleasure to be here. Thank you for the invitation. I've been recently getting into contact with you and meeting Theo and Ramon and other wonderful people when I visited when I was in Washington, D.C. and Baltimore a couple of months ago. And I was very happy to hear about the work that you are doing, of which I have to say I did not know too much. But again, thanks a lot for the invitation. I'm so pleased to be here at the same panel with so many great people, and also with Professor Muțiu, who's also from the leadership of our university. What I will do in the next couple of minutes is just briefly mention a couple of the points that we at the Department of Public Health have benefited from the US Romanian collaboration in the higher education. And before doing that, I'll just start a little bit with the history of our department. Our Department of Public Health is a relatively young department. It's the 5th department of the School of Political, Administrative and Communication Sciences, as you were mentioning, Theo. But we are quite atypical in the higher education environment in Romania. You heard Theo saying that I'm a medical doctor, but maybe, I'm sorry, maybe some of you were surprised that we're not based in a medical university. And of course, all of the other departments of public health in Romania are based in medical universities. We have 13 medical schools and 11 medical universities. But it all started close to 20 years ago. It was 2005, and the founding director, Professor Kerekes, who served as a chair of the department until 2021, was benefiting from a scholarship within a project which was funded through the Fogarty International Center. And so that was when he, who had just graduated from the medical school in Cluj-Napoca, has got into contact with what public health used to mean in the United States. He was visiting at the University of Iowa, and he spent a couple of months there. And when he came back to Cluj-Napoca, because he's very energetic, very outgoing person, he tried to persuade medical university in Cluj-Napoca to add some of the things that he's seen in the United States, because at that time, and I would say that to a certain extent, even nowadays, public health in Romania used to mean more or less infectious disease epidemiology. And so he was telling them about all of the other subdomains of public health, like environmental health, occupational health, social and behavioral health, health policy and management, and so on and so forth. Unfortunately, things did not go as he was expecting. And so instead, he managed to opened what for a couple of years was known as the Center for Health Policy and Public Health within the school where we are based right now. And I believe, because I was not with the department from the very beginning, I only joined in 2010, but I believe that the fact that he received these open doors at the School of Political, Administrative and Communication Sciences was because the school itself had been founded in 1995, so 10 years prior to that, with extensive support from the U.S. And from a USAID grant, and also from another U.S. university, Florida International University. And so we started as a research center in health policy and public health, and then in 2012 we added our first educational program, which was and still is a bachelor program in public health policies and services, which is completely taught in English. And then we added an MPH, which is the only MPH in Romania, which is a Master of Public, also taught completely in English. This year we managed to add our Romanian Bachelor in Public Health Policies and Services, and we also have a Master in Healthcare Management and Health Policy, which is more or less similar to the MHA that most of the universities have, Master in Health Administration. What I also want to stress is that throughout our history, we've been extremely privileged to benefit from collaboration with U.S. universities. And I have to say that even though we are a small team, we are just 8 full-time faculty and around 20 researchers. That doesn't compare with other departments. And I see that Ligia has joined. Ligia, who is my longtime collaborator from the Johns Hopkins University, from the Department of International Health, where I also have this adjunct affiliation. And I was in their strategy development meeting a couple of evenings ago. And if I remember correctly, Ligia, there are, I believe, 300 faculty in the department, only in the Department of International Health, not speaking about the entire School of Public Health. So that's why I was saying that we are a relatively small department. So back, what I wanted to say is that even though we are a small team, all of our full-time faculty have benefited from experiences lasting for at least one semester of having visited U.S. universities to strengthen our skills and knowledge, either in the areas of research or in the areas of teaching, so as to improve our educational programs or research. What I also wanted to mention, because Ligia is also here, my collaboration with Ligia and Johns Hopkins University interestingly started when we received an email from Ligia, and the Wilson program has been mentioned here. And I remember that it was more than 10 years ago, and Ligia was having a scholarship, a Wilson scholarship, and it was in that context that we got first in touch. And now it's more than 10 years, and we developed this collaboration with Hopkins, among other universities. And I just wanted to briefly mention a couple of the added bets that I see in this transatlantic collaboration between higher education institutions. And then, Theo, I don't know how many minutes I still have. If you give me an idea.
Sure. No, we are running out, but we were running a little bit late anyway.
Okay.
So thank
3
you,
minutes
thank you so
and
much.
I'm done.
Yeah.
I just wanted to briefly mention just a couple of things, and I'll be done in 2 minutes. First of all, one of the things that I wanted to stress out is that throughout our collaboration with Johns Hopkins, we've seen that we can be a place where students from Johns Hopkins can learn about research and can learn about working with communities. And that was maybe, I would say, from a personal perspective, it was one of the most surprising things, because, being an Eastern European, you start with these complexes that there's nothing that others can learn from you. It was such a nice experience to see that even students at Hopkins, which is, it has its prestige, can learn things from our department, which is so small and so young. And the second thing that I believe is really fundamental for our collaboration is this desire that I've seen in all of the U.S. universities that we are collaborating with for equitable partnerships. And so these are the things that I'd like to wrap up with. And again, thanking you for the invitation, and hoping that we'll stay in touch, and we'll get to learn more from about your work, and you'll also maybe have a chance to do similarly about our department, and further strengthening the collaboration between our countries. Thank you, Theo, again for the invitation.
Thank you for joining us so late in the evening.